I talk a lot about mouth breathing and why it's so much better to breathe in and out of your nose. Now, with that being said, what actually happens to your body if you breathe through your mouth every single night? This may not seem like a big deal, or it might seem completely normal, but a lot of people, when they sleep, their mouths are wide open. And that means that instead of breathing through their nose, which is how they should be breathing, they're actually breathing through their mouth. Now, what are some signs that you are a mouth breather? Well, if you ever notice day to day that your mouth is just resting open, like if you're working at your desk or something and your lips are open, that's a sign. If you wake up with drool over your pillow or with your mouth super dry, or if you know that you snore, these are all signs of you being a mouth breather. Now, what's the big deal? Well, I'm gonna go over both the short-term and the long-term consequences of being a regular mouth breather at night. The first thing that happens is a dry mouth, because when you breathe in and out of your mouth, you're getting rid of all that saliva in your mouth. Whereas when you breathe in and out of your nose, you're gonna retain a lot of that moisture. This is really bad for your teeth and your gums because your saliva is like a natural bodyguard for your teeth and your gums. It'll help dilute the acids in your mouth, it'll help keep everything clean, it'll help wash away any particles. Now, if you don't have your saliva, you're gonna be at a much higher risk of getting cavities and gum disease. And we see this all the time as people get older, because when people get older, they start taking more medications, and one of the side effects of a lot of medications is xerostomia, or a dry mouth. Now we have people that have gone many years without having any problems, and then all of a sudden, they start getting all these cavities and other problems because they do not have any more saliva. Now, what are the more long-term effects of regular mouth breathing? Well, when a kid grows up with their mouth hanging open all the time, their jaw will start to grow in that direction. So as their mouth is always open, their cheeks will keep everything constricted, so now they're gonna have a more narrow, elongated face. The problem here is now you're more likely to have crooked teeth because your jaw doesn't grow as wide, and you're more likely to have breathing difficulties or airway problems. Now you're more likely to have like asthma, sleep apnea, and even things like developmental problems or heart conditions or other diseases, because all of these are related to having troubles with breathing. But why does your face grow like this if you're a mouth breather? Well, when your mouth is always hanging open, there's no stimulus for your jaw to grow. Normally, our lips should be closed, our teeth should be slightly touching, and our tongue should be resting against the roof of our mouth. Not just the tip of our tongue, but also the middle and back part of our tongue. That tongue constantly pushing against the roof of our mouth, even if it being really gently, will have this constant stimulus for our jaw to grow. Now our jaw will be more likely to grow wider and forward in the shape of our tongue. And in this scenario, we're gonna be a lot more likely to have not crooked teeth, so straighter teeth, because there's gonna be enough room for all of them to come in. And also our jaw is gonna grow forward and wider, so there's gonna be more room for our breathing tubes to develop. Now we're gonna be less likely to have all those diseases. We're gonna be less likely to have sleep apnea. The other problem with regular mouth breathing is you have less nitric oxide. So normally when you breathe in and out of your nose, as you inhale, the air travels through your paranasal sinuses. And once the air travels through there, it produces a molecule called nitric oxide. Now, nitric oxide is very cool because it does two things. It's a vasodilator and also an antibacterial. So when you breathe in and out of your nose, it's gonna help keep everything clean, because that antibacterial aspect of it is gonna keep your whole nasopharynx area clean. So that means your tonsils, your adenoids, your throat area is all gonna have this like natural antibiotics. So you're gonna be less likely to have throat infections, tonsil infections, and you're gonna keep everything clean. But also the other aspect of nitric oxide, it being a vasodilator, helps because it helps with gas exchange in your lungs. Essentially what this does is it makes your breathing way more efficient. So now that same amount of air or that same amount of oxygen that gets into your lungs, a lot more is used more efficiently when you breathe through your nose. The problem with mouth breathing is you don't get any of these benefits. You don't get any nitric oxide. You just get this air that goes straight into your lungs. And on top of that, you don't get any filtering. With your nose, you get a natural filter. You get these hairs that filter out different dust and particles. You get this mucus that kills about like 99% of bacteria and viruses, but you don't get that through your mouth. And also when you breathe through your mouth, you breathe a lot quicker because the air comes in and comes out a lot quicker. This is a problem now because you start losing a lot more CO2 or carbon dioxide. A lot of people think carbon dioxide is a waste product and we need to get rid of it from our body. But actually carbon dioxide is really important. If you don't believe me, just ask the Bohr effect. Our carbon dioxide naturally builds up in our body when we hold our breath. So anytime we hold our breath or anytime we exercise, more carbon dioxide builds up in our body. But we don't get any carbon dioxide from our air around us. When we inhale, we get other molecules, but we do not get CO2. Technically, we get like 0.03% CO2, but it's really negligible. Now, our CO2 is our trigger to take the next breath. So as we're holding our breath, once our CO2 builds up to a certain point, it'll trigger our brainstem to take a new breath. But as you breathe quicker and quicker, like if you breathe in and out of your mouth, this trigger gets lower and lower. So now this CO2 trigger normally has to build up to here, but if you grew up mouth breathing your whole life and you were breathing really quickly your whole life, now this CO2 trigger drops down to here. So you're just going to be breathing a lot more faster. There's a couple problems with this, and I'm going to start with the first one because I mentioned the Bohr effect. When your CO2 levels are not high enough, that oxygen that gets into your lungs does not go to your cells. So I drew a little diagram here to help explain what I'm talking about. So this is a person, pretend it's a really good drawing, but it's a side profile of a person. So as they breathe in this oxygen, and this goes down their breathing tube into their lungs. Now, as our oxygen enters our lungs, it attaches to a molecule called hemoglobin. This hemoglobin is a protein that will transfer these oxygen molecules to all of our cells in our body. So like our muscles, our brain, everything that needs oxygen to survive, it's getting carried by this hemoglobin. Each hemoglobin gets 4 of these oxygen molecules attached to it. Now, let's say this hemoglobin is going to go up and deliver this oxygen to our brain, a very important place that needs oxygen. In order for this oxygen to come off of this hemoglobin or detach from this hemoglobin and actually go into our brain, we need to have enough CO2. And that's because if our CO2 levels are not high enough, then the blood pH gets thrown off. Our blood pH has to be between 7.35 to 7.45 in order for us to survive. And in order for that oxygen to come off of that hemoglobin, our pH in our blood has to drop down to 7.35. If it doesn't get to that pH, that oxygen stays attached to the hemoglobin and it does not get to our brain. And the only way to get that pH threshold is to have enough CO2. If we don't, then we're going to have some problems. This is why many people who grow up as mouth breathers do not get the right amount of oxygen that they need to all of their cells. And it all comes down to breathing more quickly. Now, the second problem I wanted to talk about with breathing more quickly is it puts you into a fight or flight mode. Think about what happens when you get anxious about something, or when you get stressed out, or when you're in a dangerous situation. The first thing that happens is your breathing starts to increase. But now you're kind of naturally putting yourself in that fight or flight mode, or that anxiety mode, or that stressed out mode. So you can chronically start to have this anxiousness or this stress. And not to mention, you're going to be more out of breath or more out of shape than someone else. If you took 2 people who are in the same situation, they have the same athleticism, they do the same amount of training, but one person is a chronic mouth breather and one person is a regular nose breather. The person who breathes in and out of their nose needs a lot less oxygen to survive, versus the mouth breather is already breathing a lot more than that nose breather. Now, if they start doing some physical activity, like they start running on a treadmill, their breathing has to naturally increase because of the exercising, and also their CO2 starts rising, so they have to start getting rid of it. But the mouth breather is already at a disadvantage because their breathing is already up to here, versus the nose breather whose breathing is down to here. But now when their breathing has to increase, the mouth breather can only go so high, versus the nose breather has a lot more extra breathing that they can do. Now, what causes you to be a regular mouth breather? Well, the short answer is mouth breathing. Because when you breathe in and out of your mouth, again, you're taking these quicker breaths, you're losing the CO2. Another thing that happens is your nose starts to produce more mucus. So as your CO2 starts to drop, your nose starts to produce more mucus in order to retain that CO2. Keep in mind, our pH in our blood has a really small threshold. It has to be between 7.35 and 7.45, otherwise we're dead. And if we do not have enough CO2 to survive, our body's going to do anything possible to try to slow down our breathing and get more of this CO2. And one of the things it does is it starts producing nasal congestion. Our sinuses will start getting congested. Our nose will start being congested. This is a natural mechanism that our body does to try to slow down our breathing. But now it's kind of a double-edged sword, because instead of breathing in and out of your nose, you're still breathing in and out of your mouth, and you're still getting rid of that CO2 at the same rate. Some other things that cause people to become mouth breathers are things like allergies or having a tongue tie. Now, a tongue tie is basically when your tongue is glued to the floor of the mouth. We talked about how ideally nose breathers should have their tongue up against the roof of their mouth, but for some people they can't even reach the roof of their mouth because their tongue has this attachment that's gluing it to the floor of their mouth. So for some people, they might need to get a tongue tie surgery in order to free up the movements of their tongue. And they also might need to do some tongue exercises. Now, I did talk about tongue exercises and that tongue tie surgery in more detail in another video, so check out the description below where I talk more about that. But the bottom line is there could be a ton of reasons why people developed as a mouth breather. The best time to change it though is now, and luckily there are some ways to fix it. The first step is going to be addressing any nasal blockages. This literally means just blowing your nose, getting out all that gunk. And this also involves doing a saline rinse, like putting a saline rinse up one nostril and getting all that gunk out the other nostril, and then doing the same thing on the other side. This also involves treating your allergies, like going to an allergist or taking an allergy medication, or using a nasal decongestant spray, like a spray that goes up your nose, up each nostril to kind of open things up. You might also want to visit an ENT or an ear, nose, and throat doctor and see if there's any other obstruction going on. But the second step, once you're able to kind of clear out those initial blockages, is to start focusing on keeping your lips closed. Once your lips are closed, you're going to have to breathe in and out of your nose and focus on that all day long. Now, while you're focusing on this, train your tongue to be up against the roof of your mouth. And again, I talked about the proper position of your tongue before, but I talked about ways to kind of strengthen your tongue and some other tongue exercises which can also help with this. So check out the description below. But now, once you can start to breathe in and out of your nose regularly, and you might have to do those first few steps multiple times because you're going to have a lot of drainage, especially if your nose has been dormant. If you haven't used your nose in a long time, and there's been all this gunk up there's going to be a lot of stuff to clean out. So you might have to just keep cleaning it and keep trying to breathe in and out of your nose. And this might even take like a couple weeks. But once you feel like you can start to breathe through your nose, tape your mouth shut. No, not when you have to like go to a business meeting or something like that. I mean when you're going to sleep. Now the tape that I like to use is called 3M micropore paper tape. It's literally like a medical grade tape. You rip a piece off, tape it over your lips. I know it sounds crazy, but this will prevent you from breathing in and out of your mouth at nighttime, and it'll encourage that nasal breathing, which is what we want. If for any chance you cannot get to this point, if you tried all the steps, if you tried spraying your nose, if you tried blowing and you tried for a couple weeks and you still cannot breathe in and out of your nose all night long, then you might have something else going on, because this is definitely not normal. You might have like an anatomical limitation, and you might need to go to an ENT to see if there's some other device or some other type of surgery that you need. One tip I have with the mouth tape, if you're really nervous, is if you don't have a beard or a mustache, this works well, but taping that tape vertically instead of horizontally over your lips. That way, when you tape it vertically, you can still breathe through the side of your mouth if you have to. It'll just kind of resist your lips from opening and kind of encourage you to breathe through your nose. Me, on the other hand, I have to tape it horizontally because I have a beard and a mustache. So with all that being said, I hope you guys understand that mouth breathing might seem harmless, but it can definitely cause some issues if it's something that is regularly done. So it's not something to ignore. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. Do your teeth actually age? Well, the answer is yes, and it'll show. But here's the good news. There are some simple ways that we have that can keep your teeth looking younger for longer. So in this video, I'm gonna go over some subtle signs that show that your teeth are actually aging that can make you look a whole lot older than you actually do. I'm also gonna go over what you can do right